Okay, so good morning, everyone. My name is Kim Johnston, and I am the manager of academics as part of our professional practice portfolio at Osler. Thank you for joining us today. We have a wonderful presentation titled Removing the Silos, Interprofessional Education to Support Hospital to Home Integrated Care. The transition from hospital to home is a critical juncture in patient care, requiring seamless collaboration among healthcare professionals. Today's session will highlight how interprofessional education can break down silos, fostering teamwork and integration to improve patient outcomes and care transitions. We are fortunate to have two distinguished presenters with us today. Dr. Susan Bookey-Bassett, a health services researcher and co-lead of the Better Work, Better Care Coalition, as well as Dr. Sherry Espin, an associate professor with extensive expertise in interprofessional education and practice. Please join me in welcoming them to the stage.
Good morning, everyone. Thank you for coming to the presentation, and good morning to those of you who are online. This morning, we're going to share some of the work that we've done over a series of 3 studies that focus on the importance of interprofessional education within the context of integrated care. Well, let's start off with the slides. They aren't moving. Okay. The slides are not moving. Okay. Okay, so what we were planning for this morning is this is a quick overview of the presentation to give you a little background to this work, to do a quick overview about what is meant by integrated care and why that's important, to talk a little bit about the current work in Ontario in terms of Ontario health teams, primary care, integrated care, a little introduction to the International Foundation of Integrated Care, if people aren't familiar with that, and the pillars of which this work is based on. And then to talk about a recent study we did where we looked at the role of interprofessional education in training healthcare professionals to work in hospital to home integrated care programs. And then finally, we'll end with an example from a case simulation that we developed that focuses on stroke care transitions. And we'll play a little clip from the video for that. So first of all, just to start off with integrated care. So people have probably heard this term. Who in the room has not heard of integrated care before? Anybody? Okay, so what is it meant when we say what is integrated care? What does that mean? So there's no one single definition, but a lot of terms are thrown around. So things like person-centered care, case coordination, case management, population health, partnerships. Really what it focuses on is really trying to bring services together around a person. And that can include healthcare services, social care services, trying to be very person-centered, bringing that care to the person to minimize some of the challenges that we have in our current healthcare system around fragmentation. And so we know that in Ontario, there's a variety of initiatives underway. On this slide, you can see just some of those examples. And again, you've probably heard about Ontario Health Teams. Anybody not heard of Ontario Health Teams? Does everybody know what Ontario Health Teams are? Do you know which Ontario Health Team you belong to, as like from not from where you work, but from where you live? Okay. That's good, because many places people don't know what that means, and they don't know what team they're associated with. So we have Ontario Health Teams, we have Ontario Health at Home, the home care services attached to Ontario Health, and we also have primary care initiatives as well. And so one photo or one image that might give you an idea of what is meant by integrated care is really just sort of pulling all these pieces together around the person, right? So Sherry and I have done work particularly focused on stroke care and trying to bring in the various care providers who are important in helping patients go through that stroke care trajectory. And we'll talk more about that later. And have people heard of the International Foundation of Integrated Care? Hands up if you have. Okay, so International Foundation for Integrated Care is a foundation that was established in 2012 out of England, and it's an international foundation of which many countries belong, and Canada has its own chapter called IFIC Canada. Recently, the North American Conference on Integrated Care was held in Calgary, and that was an amazing event. These conferences are amazing to attend because everyone who attends is so focused on really integrated care and the values around how do we provide the best care for our patients, families, and caregivers. So I would encourage anyone, if you ever have an opportunity to go to one of those events, to go, because you'll just feel like you're really with your people, which is what I felt like I was last time I went. I felt like I'm with my peeps because everybody here is so focused on trying to bring integrated care to fruition. And we know that it's a challenge. It looks different in different countries, but overall, there's a lot of people around the world working towards integrated care. And in Canada, we have, as I said, our chapter here. The Integrated Care Foundation has 9 pillars of integrated care, of which a lot of the work is centered on. And as you can see in this image here, you'll see what those different pillars are. So a lot of them would probably look familiar to you in terms of some of the other work that you may be doing within your healthcare organizations. To center our presentation today, I just want to highlight number 5, which is at the bottom of the screen, which is workforce capacity and capability. And so that pillar really focuses on how do we support building capacity among our healthcare professionals to provide integrated care. What does that look like in terms of competencies? And what does that look like in terms of how do we provide training and education to support these development of these competencies? And so our work has really focused on, at least what we're talking about here today, is focusing on how do we build this capacity. So from the literature, we know there's a need for core competencies and integrated working practices that focus on patient advocacy, communication, interdisciplinary, people-centered care, and continuous learning. So these are core competencies, which really do align nicely with some of the similar ones for interprofessional education and teamwork. We know that this building capacity is critical. Since 2015, the World Health Organization identified that that people-centered integrated care really calls for a paradigm shift in terms of how we provide education to prepare healthcare professionals to work in teams. And new models of care require different models of learning in order to for people to engage in this in these competencies. Education and workforce planning require knowledge and skills for team-based care and person-centered care. And we know from some of our previous work that interprofessional education is a critical strategy to prepare the healthcare workforce for integrated care service delivery models. And pre-licensure IPE can support that development, but also continuous development in the practice setting is also very important. A couple of years ago, we did a scoping review looking at, what does it say in the literature about how IPE is used to train healthcare professionals in integrated care. So in that scoping review, we had 32 papers of which we included in the review. And the 4 key themes that came out of that review were, as you can see there on the slide. So first of all, that interprofessional education lays the foundation for working in integrated care. It builds competencies for integrated care. It's seen as a catalyst for functioning in teams and patient care, and generates practice change in terms of things like referrals to different services and different disciplines. So that's what we found in the literature, but then we weren't really sure whether, how is this actually manifesting in practice? And so it was unclear to us whether interprofessional education was really being provided to those who are actually working in integrated healthcare teams across Ontario. And so we wanted to look at that in terms of another study. And so we then conducted another study, which I'm going to let Sherry talk about that now.
Thanks very much, Sue. So as Sue mentioned, this study was then informed by the earlier scoping review. And so the purpose of this study was to describe key informants descriptions of interprofessional education in training existing healthcare professionals to work in hospital-to-home integrated care programs in Ontario. So most of you are probably familiar with this definition of interprofessional education, but as referenced by Kate, it is that notion of when there are occasions for members or students of two or more professions to learn with, from, and about each other to enhance collaboration and the quality of care and services. So for this study, we engaged in a qualitative descriptive methodology and included a number of key informant interviews, both individual and dyad, semi-structured interviews that lasted on average 45 to 60 minutes. The informants included leaders of integrated care programs in their organization, and they were recruited from various healthcare settings in leadership positions across the province. The questions were informed by the scoping review and the results that Sue shared with you earlier. And the interviews were audio recorded and transcribed. We used both an inductive thematic analysis approach and also deductive through the lens of an interprofessional learning continuum model and the specific competencies for integrated care. So in terms of results, and more specifically, the participant characteristics, we conducted a total of 13 interviews with 15 key informants. And this happened between November 21 and June 22, so still underpinned by COVID at that time. 11 of the interviews and two dyad interviews were conducted. And so the key informants, they represented a number of professional groups, including nursing, social work, physio business, clinical managers, directors of interprofessional practice, and transition care leads. The key informants represented 13 organizations, including 10 hospitals and 3 home care agencies across Ontario. And the hospitals included both academic and teaching and community hospitals across a number of various geographic areas in Ontario, both urban and rural. So when looking at the current IPE in the integrated care programs, what participants told us really fell into sort of 3 buckets here. And in the context of the first bucket, participants spoke about formal interprofessional education and they spoke about how this included opportunities for planned learning activities involving 2 or more professions. And the most common time for IPE was during staff orientation or onboarding to the integrated care program within the organization. In terms of informal interprofessional education, key informants talked about this occurring within the context of daily practice. And so this included learning that happened through huddles, through team meetings or regular meetings, and interprofessional team rounds. And also this idea of cross-sectoral learning. This was more limited. However, participants spoke about these programs developing, and they noted that there is opportunity for cross-sectoral education in the future. And the idea of really looking at formal training, supporting home and acute care coming together. So in terms of how IPE supports implementation of integrated care, we heard about how this is through informing programs and roles, identifying IPE competencies for integrated care, and providing benefits for staff. So again, formal IPE that occurred, as we mentioned, during orientation and included content and information about the integrated care program and different provider roles. Program information included details such as patient population, eligibility, care pathways, and information about different roles was also described. And in terms of IPE competencies for integrated care, informants spoke about specific competencies around knowledge, skills, and attitude that were valuable to work within integrated care programs. And specifically, the competency of role clarity was emphasized by informants, and the need for really understanding both hospital and home care roles was viewed as key to successful integrated care. Skills such as team communication for the purposes of shared goal setting and developing a shared client service plan were also recognized as important. And specific attitudes for working in integrated care, such as positive attitudes towards ongoing learning. And others noted the need to be nimble and adaptable, and the idea too of having a belief in holistic or person-centered care approaches. In terms of facilitators to implementing IPE and hospital-to-home programs, key informants referred to three key facilitators, and these included using multiple diverse teaching and learning strategies, having protected educational time, and integrating interprofessional education as an expectation of employment. And so they spoke about multiple learning strategies, such as simulation and really bringing folks together. In terms of having protected educational time, they really saw that as necessary in order for integrated programs, care programs to be successful. And they also talked about integrating IPE and training within the processes of onboarding and orientation of new staff. So in terms of barriers, participants referred to three specific barriers to implementing IPE in their integrated care programs. The COVID-19 pandemic, as I mentioned, our data collection happened during that time. Staffing issues, and having a lack of time for education. And so the COVID-19 pandemic and the public health policies meant that people couldn't be together face to face, and they felt that that hampered learning. The notion of staffing issues and having staff available to participate. And then finally, that lack of time for planned education was also noted. So in terms of implications for education and practice, in order for us to prepare healthcare professionals to work in integrated care, it's important to include IPE and IC concepts and principles in formal academic training. We need to offer student placements within established integrated care programs to facilitate integrated care and competencies. We need to eliminate the siloed approach. IPE and within and across healthcare sectors can support understanding of integrated care programs and the role and responsibilities of various team members. And again, we want to consider innovative pedagogical approaches like simulation, case studies, role modeling for IPE and integrated care. And also, as I mentioned, enabling protected time for continuous professional development and practice. And then lastly, in terms of recommendations, key informants spoke about these recommendations really in sort of 5 overarching areas. And that included eliminating, as we talked about, silos, giving clients and families a voice, and really being purposeful about how we do that. Creating learning opportunities in integrated care, providing professional facilitation and those that are trained in terms of supporting IPE, and really providing that foundation in the theoretical frameworks and conceptual models that underpin this work, and having folks that are, that are educated in that area. So in terms of just further details, this work we have published, and you can find the results and further details in this reference. So I'll now hand it over to Sue, who's going to speak now about our current study.
I just want to get a time check too for how much more time we have before I get into this section. 5 minutes. Okay. All right. So the work that we just presented has informed another study which we're currently undertaking, and that is to looking at exploring creative opportunities for new placements for students in integrated care programs. So we have a couple more interviews to be finalized for that work, and then we'll be into the analysis of that. So future work to be presented. One of the things we've done with the work that we've done so far is really we've created this simulation, which really focuses on interprofessional integrated stroke care transitions. And so there's a lot of background here that you can see on the slides, which I won't go into a lot of detail, but just consider what we spoke about in terms of why IPE is important to work in integrated care teams. So we created this resource, which is an open access resource. It's a Pressbook account. It's set up as a document which can be used for facilitators to either teach with students or with practitioners. And we know that it's being used actually in practice in a healthcare organization already to train and work with inpatient stroke teams, and hopefully outpatient stroke teams too. So basically what we did was I'm skipping through these fast because I want to play a little bit of the video. What we did was we developed it based on best practices for developing simulations, but also for best practices for integrated stroke care. And we developed a resource that as I said, has pre-reading materials. Then it has a facilitator guide that instructors can use with students or practitioners. There's 2 scenes within the resource. The first scene is an inpatient stroke team talking about the preparation of the patient who's going to be transferred from an acute care hospital to a rehab hospital. And the second scene, which is the one we're going to try and play for you, is okay, the rehab hospital, the patient has finished the rehab treatment, and now we want to go to the case situation where they're talking about preparing Mr. Singh for discharge and to go back home to his community.
Hi, Mr. Singh. Good to see you. We're going to go over how you did in rehab and some recommendations for you to continue outpatient rehab when you go home. Does that sound good?
Sure. So how do you think you did in rehab? Do you feel like you met all your goals?
I think I did okay. I'm still not like before. Walking is really hard, and I still need help with things.
Yes. Well, we also think you did very well. But yes, there are some things that you do need help with. We're going to go over everything in a bit more detail, so we're all on the same page. Is that okay?
Sure.
Okay, perfect. So as you know, you are now using the rollator walker, and you have been much more independent than when we first started walking together. You also improved your walking distance. You're walking about 180 meters now before needing to take a break. Great. This was also captured on the 6-minute walk test. So we think you should do well walking at home, but we do suggest that you have some supervision when walking outside, and you always have your rollator in case you need to rest. We're also very impressed at how much improvement you had in the movement of your leg and arm. It's about a 90% return. It's amazing. We do still need to note that your balance needs a bit of improvement. You scored a 44 out of 56 on the Berg balance test. That indicates that you're at risk for falls. So we suggest that you continue outpatient at home. Do you guys have any questions? Okay. So the occupational therapist cannot attend, but she's provided me with a report. I'll go over that now. So from an occupational therapy standpoint, you have also been improving tremendously, Mr. Singh. When you came from the hospital, you had expressed on your COPM that going to the washroom independently is very important to you. I'm happy to say you can complete this task now. I also know that being able to attend games night was very important to you and that it was challenging to follow these games from a cognition.
So sorry, I cut it off short, but I want, this is available and we can share the link for the resource. But basically what we tried to do in this video is incorporate a lot of competencies, but also focusing on the best practices. And so if you continue to listen, you'll hear how they really try to focus on Mr. Singh's, what he wants to get back to being able to do. So really that person-centered care. And one of the things he says is about he wants to get back to working in his garden. And so we tried to build into this scenario, the complexity of stroke care transitions in our world in Ontario today. So the case is very complex. To start with, he's an older gentleman who has had a stroke. He ends up in a Toronto hospital, but he actually lives in Orangeville. So he has to go through this transition to get back to his home and community. He can't drive anymore. His wife doesn't drive. His kids live an hour away. And we developed this with staff from Sunnybrook to make it as realistic as possible based on what they're currently dealing with. And so it's been taken up by a couple of other organizations to use with training, as I said earlier. So we're happy to share. It has a facilitator guide, and really what we're doing now is we're doing another project where we're working with. Oh my God, this mouse is something else, man. I'm trying to look at the screen, but it's not. No. No. There we go. Okay, so just the last thing I was going to say is we're working with another organization right now where we're developing another experiential learning tool for teaching healthcare professionals and students about sort of what happens to more about the stroke care trajectory, more focused on the community, what happens when people leave the hospital, because we know from our work with students, and many students learn about the stroke patients only from the perspective of the hospital, unless they have an opportunity to be within a program where they're really linking with the community. They don't really get a chance to learn about that community and what happens next. So that's our current project. We're working on that. We've got family caregivers, patients involved, and again, frontline and community clinicians to help us develop that work. So yeah, and we're hoping to include that project in our curriculum in the winter, a couple of our nursing courses. But a lot of this work we see as not just being for nurses, but for broader health professions education. And I'll just put the link up there for the last, that link is the link to the whole simulation that we just talked about that's available. People can use it freely and as widely as they choose. So thank you very much, everyone, for coming, and happy to answer questions.